For many disabled people, this is a life and death situation.
A Maryland family says they're paying the price for someone else's mistake after their daughter has her medical coverage terminated. The Ginsburgs say it happened without warning and it triggered due to a notice they never received, and now they're facing tens of thousands of dollars in medical bills until it's resolved. WBAL-TV 11 News investigates. Tommy Clark reports they're far from alone.
Lauren loves her caregivers, and after you meet Lauren, I think you can see why they love her.
Albert Ginsburg's daughter looks forward to seeing her longtime nurse. Lucy assists Lauren with everyday tasks like maneuvering out of bed and navigating to her favorite activity.
She goes to daycare, where she's sort of a superstar.
Here we are. Here we go.
Where the 53-year-old expresses herself through art. Her creations are framed on her bedroom wall next to photos of Lauren as an early teen, before she suffered a cerebral hemorrhage. Since then, her family has relied on Maryland medical assistance, or Medicaid.
The caregivers are extremely invaluable, just like nurses are in the hospital. They take care of the patients, and it's their total well-being. Without them, Lauren couldn't survive.
Right now, the Ginsburgs are paying for that care out of pocket because for the second time, Lauren's coverage has been dropped.
All of Lauren's services stopped. There was no funding for any of her services.
Lawyer Lindsay Moss attributes the termination to a federal requirement known as redetermination. Her team discovered Lauren's family should have received a form in the mail that explains the review process, including eligibility requirements, along with a letter informing them that benefits may stop beginning November 1st. The problem, she says this notice never arrived. Moss Law Firm represents multiple cases just like Lauren's.
People started getting stuck in this cycle where they would lose all of their funding for absolutely no reason, where they had years and years of funding, and suddenly their providers would be putting in for repayment from the state for services, and they were getting denied with no explanation.
Moss tracked down the letter sent to a home the Ginsburgs lived in over a decade ago, despite Lauren's current address being active in the system for years.
To have this happen now 2 years in a row, think about all of the cases that are not as black and white as hers, and all of those people, and now think about them not having advocates or having attorneys in the community.
Moss says the confusion stems from the pandemic, when the federal government kept everyone in the program no matter their eligibility. In the spring of 2023, a new federal law mandated states resume those verifications on a rolling schedule. Maryland sends out letters, but errors like what the Ginsburgs experienced have left many in the dark.
Lauren's case is not surprising.
Milas Manley says she sees similar mistakes impacting clients at her practice. Both lawyers agree it's part of a much larger problem with the system, a predicament she calls unacceptable.
Incredibly unnecessarily complex, and where we're seeing a clog right now is in the Maryland Department of Health's Eligibility Determination Division, what we all call EDD. And they are the ones who have to approve, look at the Medicaid application and look at the finances and approve that. That's where everything is just coming to a screeching halt.
Their hope is for more awareness surrounding care for Maryland's most vulnerable population. For now, the Ginsburgs are stuck behind the red tape, forced to reapply into the program.
My team. The team. We're a team here.
Saying they'll do whatever it takes to make sure Lauren doesn't get left behind.
You can't control your destiny here, and we're in a crisis situation. So every day, it's the first thing that comes to mind in the morning when I wake up, as well as when I go to bed.
In Baltimore, I'm Tommy Clark, WBAL-TV 11 News investigates.
Tommy, thank you very much. And the Maryland Health Department released a statement that reads in part, MDH is working in partnership with stakeholders and providers to enhance and improve the process for these complex Medicaid eligibility reviews. They also explained that there is an appeals process for these cases, including a 120-day reconsideration period. And even if someone successfully appeals and is reinstated, they'll still be at a loss for any expenses they paid during the time they were not covered.